welcome. I'd like to introduce Dr. Ted Chan with UCSD Health System and also the San Diego Beacon Project lead. So enjoy.
Okay, why don't we give everybody a minute to sit down here. Good morning. My name is Ted Chan, and I want to welcome you all to today's event. The first thing I'd like to do is recognize some of the public officials who have joined us today from the local, state, and federal levels, some of whom you will be hearing from very shortly. I'd like to recognize Supervisor Ron Roberts from San Diego County. Also from the county, Nick Macchione, the Director of Health and Human Services Agency. From the state, Alex Kam, the Director of the California Office of Health Information Integrity, is here. As well as Laura Landry, the CEO for Cal eConnect. And finally, at the federal level, we are honored to have Herb Schultz, the Director of Region 9, the U.S. Department of Health and Human Services, here with us today. It is fitting this morning that we are meeting here today at Balboa Park, where I'm very excited to tell you about the developments in the San Diego Beacon Community Project. Balboa Park is a true community resource for all San Diego, and similarly, we believe the Beacon Project will also become a community resource that will benefit all San Diegans. Just over a year ago, San Diego was selected by the Federal Office of the National Coordinator as one of only 17 communities to lead the rest of the nation in advancing health information technology to improve care. During the first year of our 3-year project, we formed a partnership of healthcare providers, clinics, hospitals, emergency medical services agencies, and public health organizations to ensure a concerted and consistent effort across our community with the goal of improving the quality of healthcare through information technology. The San Diego Beacon's largest investment in this regard is the implementation of a health information exchange, where providers will be able to access vital health information from participating sites regardless of where a patient may have received care in the past. As a practicing emergency physician, I can tell you that we often struggle to obtain important patient information, which in turn can greatly impact the care we can provide in the emergency department. There's no doubt in my mind that a robust health information exchange that provides physicians and nurses with accurate and up-to-date medical information will lower the risk of medical errors, reduce unnecessary tests and procedures, and improve the quality of health care for patients. We are now in year 2 of the project, and because of the tremendous collaborative work and planning of our partners, I am proud to announce that we are ready to launch the first phase of the San Diego Beacon Health Information Exchange. The exchange will go live next month, and with healthcare providers at selected sites, and will expand to include physicians, nurses, and other providers throughout our San Diego community in 2012. And with that, I'd like to turn over the program to Supervisor Ron Roberts, who has a few comments.
Thank you. Good morning. I want to thank Dr. Chan, who has been working on this diligently. I'm excited to be here with this group of truly amazing people to help to spread the word about a project to improve health care and the quality of life for all of San Diegans. About a year ago, we were at a meeting, several of us in Washington, D.C., to learn more about this effort. The people that were in attendance, like Nick Macchione, will remember it clearly because it was so bitterly cold that if nothing else, you will remember that. But we learned a lot. As Dr. Chan mentioned, we're one of only 17 communities across the entire country that was chosen to be a grantee for the Beacon Community Program. We have a chance now to lead the nation in reforming healthcare in the delivery systems through the advancement of health IT. And this is truly an honor for us. It's one that can be directly attributed to our strong collaboration here in San Diego. our collaboration in putting into place innovative programs to improve healthcare in our community. And we're fortunate to have UCSD at the helm of this very impressive group of San Diego health providers. This partnership aims to improve the coordination of care and health outcomes by bridging the communications gaps that currently exist between the various health delivery sites. And the only way it will succeed, and I can't stress this enough, is to have full collaboration and involvement of all of our health systems and institutions. Our success and effectiveness depends completely on that. Last year, when we were in Washington, D.C. to learn about the program and its benefits on the healthcare, it was very informative. The experience gave each of us a much fuller understanding of the potential for this to improve our overall system. And if done right, now let me restate that, when we do it right, with full participation from all partners, money and lives will be saved. The health information exchange that will be established using this grant will give physicians faster access to more accurate patient health information. It'll allow better diagnosis and treatment without running redundant tests and costly scans. The fact of the matter is that most people know more about the maintenance of their automobiles than they do about their own health care, me included, definitely in that group. And we've come to accept, we've taken things that are very important to us, and we don't worry about the electronic nature of them. Think about an ATM where you can go anywhere and access your money. If we're concerned about accessing medical records, we should be equally concerned about those kinds of systems. This has an enormous potential. By instituting this tool, we can ensure that this lack of knowing or understanding about one's own health status does not compromise lives. Once fully operational, the Health Information Exchange will allow an emergency room doctor to obtain your individual health records, including medications you are taking and conditions you have been diagnosed with, and to use that in addressing your immediate needs in the hospital. This will be particularly important for those patients who arrive unconscious and aren't able to share any kind of information. Also, as stewards of the public health, the County of San Diego is responsible for preventing the spread of communicable disease. Having access to comprehensive regional population data for immunizations and disease surveillance through the Health Information Exchange will help us do a better job to protect the public. Having the immunization data in an electronic form will allow our partners in the schools to know better if a student is up to date on his or her vaccinations, which is a requirement for enrollment. The schools won't have to rely on stamped paper cards, making it less likely that information will be lost or delayed, which can keep a student out of the school. This saves time and it saves money. And we'll also be able to use the data to more easily drill down to the neighborhood level to identify gaps in coverage and better target resources or information. Another exciting component is the ability to access region-wide statistics, such as the BMI, the Body Mass Index data. This will help us target resources towards the county's long-term investment in curbing obesity rates and in fighting against some of the chronic diseases that are responsible for a majority of our preventable deaths. You're going to hear a lot more about our 3-4-50 program, which is all tied in to this effort. Finally, I want to share with everyone that a short DVD has been created for use by all of our partners in helping to raise the awareness in the benefits of this health technology, specifically the Health Information Exchange. If you have a group that is interested in learning more about this topic, you'll be able to access the video from any of the partners represented here, and also from my personal website, www.ronroberts.com. But it's going to be available all over. I want to thank you for being here. We're very excited about the potential for this being a game changer in San Diego, and in turn, showing the rest of the country how to do it. I'd now like to turn this over to Dan Gross, who's the Vice President of Hospital Operations at Sharp Healthcare, but most importantly today, he's the Chairman of the Beacon Community Steering Committee. Dan?
Good morning, everyone. It's a pleasure to be here with all of you, and it's an honor to represent the steering committee on this exciting project. I think most of us in the room who are healthcare providers realize that we're probably at an unprecedented point in our healthcare era. We see healthcare reform coming towards us, and over the next 5 years, there are certain things that we know that we're going to have to do in this community to make certain that we serve our patients well. We're going to have to basically improve the quality of care. We're going to have to drive down the cost of care, and the vehicle to do that is through information technology, through having data, and through collaboration and through partnership. The Beacon Project brings to San Diego one of the most unique and extraordinary opportunities for us to come together to improve the health of San Diegans. Collaboration and partnership is the cornerstone of the Beacon Project. It's been mentioned that we are only one of 17 communities in the United States to receive such a gift. Many people might say, why? People like all of you in this room and Supervisor Roberts and I, who have been in the healthcare business in this community for a long time, are not surprised that we were selected. If you take a look at San Diego and you take a look at our past collaboration, if you think about our advanced integrated healthcare delivery systems, and you think about our existing use of information technology, the question would be, why not choose San Diego? Still throughout this country, one of our great hallmarks is our collaboration around the trauma system and trauma care program. I look at Jim and our paramedics and EMTs in the room. And so indeed, I think we will be able to deliver to this community something that is greatly needed. I just happened to be with a group of medical staff members this morning prior to coming to this meeting, and I told them that I was coming here and that I would be representing the Beacon Steering Committee, and gave them a little additional information about the project. And they truly exhibited and articulated great excitement when they heard that they were going to be able to receive information about patients that were cared for at another facility. As they said, you mean I'm not going to have to repeat tests? You mean I'm really going to have some medical history available to me to guide a plan of care? So this is a wonderful, wonderful thing for San Diego. I would like to acknowledge the degree of collaboration and identify the individuals that are represented on our steering committee. On our committee, we have the Council of Community Clinics, the County of San Diego Health and Human Services Agency, the Hospital Association of San Diego and Imperial Counties, Kaiser Permanente, Naval Medical Center, Rady's Children's Hospital, San Diego Medical Society, Scripps Health, Sharp Healthcare, UCSD Health System, and the VA Medical Center. Much work has already taken place, yet we have great work that lies ahead of us. I appreciate all of you being here today. Please help us spread the word about this great gift and this wonderful opportunity for San Diego. Thank you. And at this time, I would like to introduce Alex Kam, Director of the California Office of Health Information Integrity. Alex.
On behalf of Secretary Dana Dooley, we also would like to extend our congratulations to the Beacon stakeholders and the San Diego community for this extraordinary achievement and this kickoff into health information technology and health information exchange. Cal OHI is responsible for the development of patient privacy and protections in California. We're working with a lot of stakeholders to develop the patient policies for electronic health that will enable electronic health exchange to expand and continue. One of the most important pieces of this is to create and maintain a trusted environment for your patients. It is very easy for patients to get concerned about privacy and security issues, and Cal High has been working very closely with the Beacon stakeholders on the development of informing processes and a consent agreement. So on behalf of the state, we will be overseeing very closely the progress that the Beacon Exchange makes in these areas. The Beacon project will also be a key piece in informing the state in terms of what policies and processes it needs to consider as it moves forward in health information exchange. We look forward to working very closely with the Beacon, to learning what we need to know, what new policies need to be considered, and eventually it will enable the exchange and connection of health information exchange between Beacon and other regions of California, and ultimately nationwide. So this is a very significant achievement for the San Diego community, and we congratulate you. Thank you very much.
Thank you, Alex. I want to introduce another speaker now, Herb Schultz, who I introduced earlier as the director for Region 9, which is all of the western United States for the U.S. Department of Health and Human Services Agency.
Good morning, and I'm thrilled to be back in San Diego. I was trying to count up as I was driving down here, driving carefully, by the way, from Los Angeles, how many times I had been in San Diego during my now almost 2 years in this position, and it's too numerous to count. And that's not because just that I love the warmth of San Diego. It's because I love the creativity, the partnership, and the collaboration, the institutions, the entities, the consumers, the providers, and everybody else. So give yourselves a round of applause for everything that San Diego stands for. You know, when I was thinking about this morning, and by the way, again, my name is Herb Schultz. I'm the Regional Director for the U.S. Department of Health and Human Services. I had the privilege about 2 years ago of being appointed by the President to this position and serve as the key representative for this region for Secretary Kathleen Sebelius, my immediate boss. And I had the opportunity to talk with her recently about where beacons were and talk about the 2 beacons in our region, one in San Diego here and the one in Hawaii, where I'm actually going to be hopefully in about 6 or 7 hours, however long it's going to take me to get to San Francisco to get to Hawaii. But I don't want to digress. What I want to point out is that you all know that San Diego, city, county, community, has been a leader in health and human services for years. And I think we at the federal level, I have my VA colleagues are here as well, and I want to acknowledge them. You know what this community can do because you've been doing it. But what is so extraordinary about this Beacon Award, and I want to sort of put it this way, it's the Triple Crown. Now, why is it the Triple Crown? First, how many consumer patient representatives are out there? I saw Liz Helms from the Chronic Care Coalition was here. Liz, are you still here? Okay, so doctors, nurses, other healthcare providers, clinics, ambulance. Raise your hand if you're here. Okay. City officials, county officials, academic UCSD officials. Okay. Let me tell you why San Diego is the Triple Crown when it comes to healthcare reform. Because my region is 8,000 miles from west to east, as I like to call it, Guam to the Arizona border. But we're 4 states, 3 territories, and 3 islands that you can actually see up on that map in the Pacific. I was really appreciative of it, thank you, because Micronesia, Palau, and the Marshall Islands, and public health is very much a part of us. And the point I want to make is that San Diego in the past has proven to be a model. It's proven to be a model because of its diversity, because of its coordination and integration of healthcare systems, but of its people. And so when I call San Diego the Triple Crown, I call it the Triple Crown because of this. 2 years ago, in March 2010, when I was the senior advisor to Governor Schwarzenegger, I was overseeing the implementation and the oversight over the American Recovery and Reinvestment Act. Well, why is that important? Because San Diego then was awarded only one of 35 in the country, the Communities Putting Prevention to Work Initiative grant. In May 2010, a couple weeks into my tenure as regional director, San Diego was awarded one of 17, as we've already discussed, to be the beacon. And a couple of weeks ago, maybe now a month ago, Nick Macchione will remind me of the date, San Diego became one of only 61 awards that were given across this country for community transformation grants. And so when I talk about Triple Crown, I mean Triple Crown, because we all know that health information technology, as technical as it sounds, and technology, what it means is patients' access to better care, providers' access to information to make decision making, and increasing our quality of care. You know, this is my 20th year of testing positive for HIV. And I sort of thought about, as a person living with a chronic health condition, and thinking about all of those people in San Diego today who maybe have chronic health care conditions, or, as we'll hear from a patient, at risk for chronic health care conditions, an event happens. And just after Labor Day of 1999, when I was new in California, I dropped in a hotel as part of a senior management retreat working for AIDS Project Los Angeles. And if I tell you what I went through between having to call an ambulance, between having to get into an ambulance and make sure I was getting to the hospital that my physician practiced in, which is not where I was going to go, and then eventually to get into the emergency room and find out that I had very severe acute pancreatitis from a medicine reaction and spent 9 days in that hospital and 3 weeks recuperating. I do not believe that would happen in San Diego. I don't think it would happen today because of what Beacon has already done in bringing the community together, and you'll hear a patient testimonial. And while we already are sort of like pinpointing San Diego, the model, I think this program will once again prove, with all of the great work of the folks out here, that no one in San Diego County, and indeed teaching the rest of the nation, that this type of partnership, collaboration, coordinated, integrated care can help and will happen in this county and in this city and in all of the communities within this county. So on behalf of the Obama administration, on behalf of Secretary Kathleen Sebelius, my boss, I want to thank Dr. Chan and his leadership, and all of you that are affiliated with the Beacon Project. Hold up your hands. Great. See? Partnership and collaboration, congratulations. For all of you that are with Dr. Macchione and the county, hold up your hands. Thank you. Ambulances, rescue teams, community clinics, academics, patient advocates, and the rest of you. Okay? That was meant to say that this is a historic day because we have 17 Beacon communities in this country. And I feel fortunate to be the regional director to have 2 of them in this region. But this morning, we are, and I believe the nation is, watching an effort like this in a community that knows how to collaborate, that has already demonstrated great and significant results, that more work needs to be done and a model needs to be born, but it's a triple crown, and I have no doubt that the Beacon Community Project will be a model for the United States of America. So congratulations to the San Diego community. Thank you.
Thank you, Herb, and thank you all for your comments. A lot has been said this morning about the Beacon community, about the transformation of care, and about the health information exchange. But our Beacon is really about patients. And we are fortunate today to have 2 patients whose lives and health have been impacted already by the health information exchange that we're standing up here in San Diego. I want to recognize Mr. Thomas Bryan. He's a veteran who who not too long ago was visiting his caregiver, and who the caregiver was able to access his medical information from a different facility electronically while he was at the clinic. And because of that, he wasn't prescribed the medication that he was allergic to. Mr. Thomas, you want to wave and say hello to everybody? Now I'd like to introduce Mr. John Dalton, who is here today to share his story of how the health information exchange impacted his care when he suffered a heart attack recently. Mr. Dalton?
Thank you. I look around at these distinguished people and I say, what am I doing here? But they have asked me to come and tell you my story from the time I thought I was having a heart attack and until I had the good care. And that I think, like most men, we don't even go to see a doctor because I'm not sick, why should I go? But I have found out that if you've had any kind of heart in your relationships back there, you should go to a doctor and tell him, my father had a heart attack and he died. And then they would check you out. They would have found my problem sooner and possibly gave me some medicine so that they would have relieved that. I wouldn't have had the problem. Anyway, it started. It's going to be funny, and I'll try not to babble on. I was on my motorcycle, and I was going to the house because I had to go to pick up 2 of my grandchildren. And I was feeling a little bit of pressure, but nothing. Maybe I have indigestion or something. I picked up the first kid, then I had to go to Point Loma to pick up the other one. I picked him up, and boy, the pressure was really getting bad. And I'm going, something's going on here. But then I picked the other one up. As I got to Rosecrans and Sports Arena Boulevard, there's a Walgreens there, and I started to sweat. And I mean, I don't really sweat, but I'll tell you what, it was like water running off of me. So I went into Walgreens, and I went back there, and I says, please call me an ambulance. So they did, and I'll tell you what, it seemed like seconds that ambulance was there. Paramedics had me. They had me inside. And it's not like when you're watching a TV show. They can actually get on something and call the hospital and say, hey, we're coming, and here's the problem with the guy. So they had all that information before I got there. And I didn't know they were doing all this. So anyway, I get up there, and they just zipped me right in. They took me in, gave me a shot, kind of made me a little drowsy. They went in. They found the problem. They grabbed it. They took it out, and I said, okay. I wanted to get up and go home. I felt so good. No, you can't get up. There's no way. And I actually was trying to get up because, you go in emergency, they fix you, they wrap it, and they say, okay, you can go home now. Come see us in a couple, 3 days. Well, second time I tried to get up, somebody grabbed my head and said, you will not move, or I'll have to strap your head down. Okay. But anyway, so I laid there, and then they were done, and they were cleaning up and doing whatever they do. And all of a sudden, there was 8 members of my family alongside me, and the doctor said it was okay for them to come in. And my wife, she says, well, what did you do? How bad was it? And the guy showed them right up on the monitor exactly what he did and made them feel comfortable, which made me feel comfortable. Anyway, I was in there a couple days. They did so many tests on me. And, I mean, it seemed like there was somebody in there every 20 minutes, blood test, this test, check your heart, do this, do that. And finally, I've gone home, and then my primary care is Kaiser. I've had so many tests with Kaiser, and they've taken so much blood out of me. I told them, I said, if I knew I was going to give this much blood, I would have donated it. But anyway, the ambulance, the UCSD, everybody took such good care of me. It's unbelievable what we can do nowadays. Probably 15 or 20 years ago, if I had that, they would have cut me open to find it. So for all you people out there that have helped me, thank you.
Thank you, Mr. Dalton. Mr. Dalton's story is really about how we've been able to connect ambulances and hospitals. His EKG was actually transmitted wirelessly from the paramedics to the hospitals, so the hospital had that information before the patient ever arrived, before he ever arrived, and they were prepared to take care of him in the emergency department and actually take him to the cath lab, and improved his outcome as a result. So, in closing, what I want to tell you all is that starting in December, this coming month, participating hospitals and clinics in San Diego County will begin exchanging information. In fact, already some hospitals are exchanging information with the paramedics, and as you can see, it greatly impacted the life of one patient, a very important patient, Mr. Dalton here. And throughout 2012, the exchange will be expanding to include other hospitals, clinics, and participating providers. For those of you who are from the media, your packets include 2 videos that are produced with our partners that explain more about the health information exchange, as well as the patient testimonials on how it's impacted their lives. In addition, representatives from our partner organizations will be here after this press conference and available to answer any questions or provide you additional information at the conclusion. Finally, we want to direct all San Diegans who are interested to visit our website, www.sandiegobeacon.org, to learn more about the San Diego Beacon Health Information Exchange, how to get involved, and to learn more of which providers and participating sites are on board and which will be coming on board over the coming year. Thank you all for coming. We really appreciate it, and we hope to get the word out to everyone.
Always good to see you again. Thank you.
Nice job, Ted. Good job. Good job. Yeah.
Appreciate it.
Yeah.
Great comments.
Yeah. Well, we'll keep this going. We might have to call upon him to help us with some of our pressure on him. Don't be surprised if
I told my staff that if we have any lingerers out there, I may kick them. That we can do better than you. Okay.
we might have to.
Yeah.
But we're giving it a good
Okay.
college try.
Yeah. I know what you speak of. Okay.
Thank you.